Hello, everyone. I am Dr. Demilade A, Adedinsewo, and I am chair of the American Heart Association scientific statement titled Heart Failure Occurring in the Perinatal Period. I am a non-invasive cardiologist at Mayo Clinic in Jacksonville, Florida. This statement was developed in collaboration with a distinguished group of experts whose contributions were invaluable to the project. Today, I am joined by my co-chair as we engage in an important discussion telling you about the scientific statement.
Hi, everyone. My name is Nosheen Reza. I'm an advanced heart failure and genetic cardiologist at the University of Pennsylvania, and I'm vice chair of the writing group for this statement. And we're pleased to share key insights from this statement for our audience.
Wonderful. So I'd like to just give you a little bit of a background as to why we think that this paper is important. So heart failure during pregnancy and the postpartum period remains under-recognized despite being a major contributor to maternal morbidity and mortality. And we know that heart disease accounts for approximately 27% of all pregnancy-related deaths in the United States. We also know that many of these deaths are preventable. One of the main challenges is that symptoms of heart failure, such as shortness of breath, fatigue, or lower extremity swelling, often overlaps with normal pregnancy symptoms. And in this case, it can lead to delays in diagnosis and also delays in time to starting appropriate therapy. As a result, heart failure in pregnant and postpartum individuals is often hiding in plain sight, is how I would put it. And there's evidence that when we miss or when the diagnosis is delayed, this can have serious consequences for both the mother as well as the baby. Nosheen, can you just tell us a little bit more about the purpose of the paper and, our approach and how we put this together?
Absolutely. So, this scientific statement really brings together the current evidence to better define and address heart failure that occurs during that perinatal period from pregnancy through 1 year postpartum. We discuss heart failure due to cardiomyopathies, including both pre existing and new onset disease, and we outline key challenges in diagnosis, risk stratification, and management. Our goal with this statement is really to highlight the gaps in knowledge, standardize definitions, and provide a framework to improve the recognition, clinical care, and outcomes for this population. So, Demi, I'll hand it back to you to really summarize the main messages of our statement.
Thank you so much, Nosheen. So I would like to leave you with three key messages. One of them being that we emphasize early recognition. Timely diagnosis is essential as delays in recognizing heart failure during pregnancy and postpartum is a major driver of adverse outcomes. And early identification really just offers us an opportunity to intervene early so that we can improve survival. Second thing is that the postpartum period remains a very high risk window. Maternal cardiovascular risk does not end at delivery. In fact, the postpartum period extending through that 12-month window is a vulnerable time for mothers with many preventable adverse events occurring after discharge from the hospital. And finally, in the statement, we also emphasize that we need better tools and more inclusive research. There remains a need for improved screening strategies as well as standardized diagnostic criteria. And we need to include pregnant and postpartum individuals in heart failure research so that this can help us generate the evidence that we need to guide care in this population. We also talk about opportunities to leverage emerging tools such as artificial intelligence to enhance early detection in clinical practice. Nosheen, would you like to add anything else to this?
What an amazing summary, of course, as always. And in addition to the points that you highlighted, I want to add that we present also a comprehensive summary of the current evidence and discuss key considerations for both screening and diagnostic testing, which is often a challenge in these individuals. We include the timing and selection of diagnostic tests for women with or at risk for heart failure, all during the preconception period, during pregnancy, and the postpartum phases.
I would like to sincerely thank our Vice Chair on this statement, Dr. Nosheen Reza, and the entire multidisciplinary group of experts whose dedication and collaboration on this important work made it possible, as well as the American Heart Association for their support. This work really reflects the contributions from all the members of the group who are experts that are committed to improving cardiobstetric care, and we're really grateful for all of their work.
And I'd like to add that we also encourage clinicians, researchers, and healthcare teams broadly to read the full scientific statement, access the resources, and help us better understand the evolving evidence and opportunities to improve care. Because ultimately, increasing awareness and improving detection and management of perinatal heart failure has the potential to save lives and significantly improve maternal health outcomes.